Okay, we're talking about the bones of the vertebral column for axial and appendicular skeleton for Chapter 8, Section 5. You should be able, after going through this section, describe the functions of the vertebral column, list the 5 types of vertebrae, name the 4 spinal curvatures of an adult vertebral column, explain the sequence of curvature development, identify the parts of a typical vertebra, and compare and contrast the different types of vertebrae. Starting with the vertebral column, there are 24 individual vertebrae and a fused sacrum and coccyx. Technically, there's 5 sacrum or sacral joints, but they're fused into one, and there are technically between 3 and 5 for the coccyx, or the coccyx, as some would say, typically 4 of those, but technically fused as one. The divisions or the regions, there are 5 of them of the vertebral column. They're identified with a capital letter for the region followed by a numerical subscript, and indicates sequence from the superior to the inferior locations, going the lowest number being superior and going to higher numbers as you go down the vertebrae downward. Cervical vertebrae, they form the bones of the neck. There are 7 of them, C1 to C7. C1 articulates with occipital condyles, and the thoracic vertebrae, they form the superior region of the back. Each articulates laterally with 1 or 2 pairs of ribs. Now there's 12 of those, T1 to T12. The lumbar vertebrae, they form the inferior concave region, or the small of the back, concave, curving in, convex, going outward, like thoracic spine's more convex, generally speaking. There are 5 vertebrae of the lumbar spine, L1 to L5. The sacrum is formed from 5 sacral vertebrae, S1 to S5. They're fused into one single structure by your late 20s, essentially. They laterally articulate with 2 hip bones. And the coccyx, or the coccyx tailbone, is formed from 4 coccygeal vertebrae, C1 or CO1 to CO4, to differentiate from cervical. And they start to unite during puberty. So here we have our spine, posterior view versus anterior view, the cervical curvature, very slightly concave, a little bit for the most part there, C1 to C7, right? And the vertebra prominence here, going to the posterior aspect of the spine. And then you have the transverse processes here and here, this being more of a anterior type view here versus the lateral view, right? And then we have the thoracic curvature, which is again a little bit more convex, going outward behind you a little bit. And that's T1 to T12. And the intervertebral discs are between each vertebra, and they're designed to absorb shock. They're fibrocartilage, if you remember. And then intervertebral foramen here, the space between each vertebra, and the spinous process here. And lumbar vertebrae, there are 5 of those, L1 to L5, and you'll see the vertebrae are getting bigger and bigger as you go down because it's more and more weight supported above it. And then you have the sacrum, the fused sacrum, typically 5 fused sacral vertebrae and 4 typically fused coccygeal vertebrae for the coccyx. There are 4 spinal curvatures, the cervical, the thoracic, the lumbar, and then the sacral curvatures. It gives the column some flexibility, better supports the weight of the body than a straight spine, unquestionably, and appears sequentially during the fetal, newborn, and child development stages. Primary curves, the thoracic and spinal curvatures, are present at birth. They result kind of the C shape of the column, of thoracic and sacral. The secondary curves appear after birth. They help shift the trunk weight over the legs. Technically, your shoulders should be lined up over kind of your ankle bone. If you're standing as you grow and you get older, that's where it should be with a good posture, ideally. It helps shift the trunk weight over the legs. The cervical curve appears when the child's able to hold their head up at about 3 to 4 months, when the child can hold their head up completely on their own for more than a brief second before it falls back down. Trying to develop, it's a lot when the head's big and the body's small and you're trying to develop your musculature. Lumbar curve appears when the child's learning to stand and walk by the first year of life. Kyphosis is an exaggerated thoracic curvature, so it would basically be exaggerated, more convex looking, okay? And it produces kind of a hunchback look, and it may result from osteoporosis is one possibility. Lordosis is an exaggerated lumbar curvature, where you got that excessive curve in the lower back, where it kind of makes you arc your back, the opposite, whereas kyphosis tends to make you look like you rounded forward. Lordosis tends to be more of an arch in your back, like you're overextending too much. That said, you have the exaggerated lumbar curvature, like what some will call a swayback, for lordosis at times when the back flattens. Also, potentially, the lower back. This may result from added abdominal weight, okay? And scoliosis, there's an abnormal lateral curvature and may require a back brace or surgery. Common structural features, the body is a thick anterior weight-bearing structure. Vertebral arch is posterior to the body. The vertebral foramen is an opening enclosed by the body with the vertebral arch of the vertebra. And the vertebral canal, is formed by stacked vertebral foramina and contains the spinal cord. So the intervertebral foramina, there are lateral openings between the adjacent vertebrae, and they're passageways for spinal nerves extending to the body. And that's the purpose for that space. And the vertebral arch is composed of 2 pedicles and 2 lamellae or lamellae. And the pedicles originate to form the posterolateral margins of the body, and the laminae extend posterior medially from the posterior edge of the pedicle. The spinous processes project posteriorly from the laminae junction, and the transverse processes are lateral projections, right? Transverse plane on both sides of the vertebral arch. And then the superior and the inferior articular processes originate at the junction between the pedicles and laminae. They each have a smooth surface. It's called the articular facet. And the inferior facet articulates the superior facet of the next inferior vertebrae, next one down. It's a stack of vertebral bodies, that are stabilized by ligaments. That's what you're looking at with your spine, right? These intervertebral discs, they're pads of fibrocartilage that separate the vertebral bodies. They have an outer ring of fibrocartilage called the annulus fibrosus, and their inner gelatinous region called the nucleus pulposus. There's shock absorbers between the vertebral bodies, and they allow the vertebral column to bend, and they allow it to absorb shock, of course, too. And they actually get fed. They actually feed off of having some of that shock. It helps being a healthy spine by having sufficient shock, not overdoing it. If you overdid it, well, you're probably going to be able to maintain posture and maintain position. That would be the difference there. Usually more of a degenerative thing over time, typically speaking, when someone has an issue with the discs of their spine. We'll talk more about that typically more in the second semester, 247. Now this is looking at a thoracic vertebrae. It's kind of like a giraffe from this angle. That's one way of identifying a thoracic vertebrae. The spinous process here, then we have the transverse process out to the sides because you're looking from above, right? And the superior articular facet, and the superior articular process, the vertebral foramen, our lamina, of the vertebral arch, and our pedicle right here. And then we have our body, the body of that vertebra. And then more views here are the posterior view versus the lateral view, this time the lumbar spine here. And we're looking at here, I'll zoom in here. So we're looking at the body of that vertebra. This is the posterior view from behind, right? The transverse processes sticking out here. Superior articular facet that articulates with the above vertebra. And the inferior articular process playing a role with the lower vertebra, and superior articular process of L4 in this case here, and there's the lamina here, our spinous process below, and the inferior articular process. We have the other view, the laterally here, the superior articular process, the pedicle, intervertebral foramen, of course our invertebral disc, transverse process, our spinous process, inferior articular process, and of course the body. The cervical vertebrae are the most superiorly located vertebrae. They're kidney bean shaped type bodies. They support only the weight of the head. Some will say that looking at the superior view, it looks almost like a happy smiling fish. That's one way of looking at it, whatever helps you see it, right? They're relatively small and light. Distinguished by the transverse foramina in the transverse processes. They house the vertebral artery and vein. And looking at this here. So these characteristics of our thoracic and lumbar vertebrae. So here's our transverse process. Here's where it looks supposed to look like a happy fish. The superior view of the cervical vertebrae here. A transverse process, transverse foramen, superior articular facet, and there are bifid spinous process. The lateral view. You can see a little more like little fish-like thing potentially there, at least that's a possibility. But again, whatever helps you see it. The spinous process protruding the posterior here, the transverse foramen there, the body, and the inferior articular facet and superior articular facet. Cervical vertebrae, Atlas C1. The top cervical vertebrae is called Atlas. It supports the head, like Atlas supported the world, right, for mythology. Articulates with the occipital condyles at the atlanto-occipital joint, and it permits that nodding motion, that cervical motion here, forward flexion extension there. It lacks body and spinous process, and its lateral masses are connected by the anterior and the posterior arches. And they have slight protuberances, the anterior and the posterior tubercles, and the superior and the inferior articular facets. They articulate with the occipital condyles and the axis. And of course, you have the articular facet for the dens on its anterior arch. So here we have the superior or anterior view, excuse me, of the, no, it is the superior view of the atlas, C1, C2, or C1, excuse me. I'm getting ahead of myself with the axis, the next one down. The superior articular facet here in this anterior tubercle, as you're looking at from above, the transverse process going out to the side, right? The transverse foramen, posterior tubercle, and the posterior arch. And of course, atlas or axis, excuse me, is C2, the next one down. That's going to provide more pivot, more rotational type motion, whereas atlas is more sagittal plane type motion, technically, flexion extension. Axis is going to provide you with rotational capacity for that, just for that cervical spine motion here. Okay, it's the body of axis is fused there, produces the dents, which acts as a pivot for the lateral rotation between the atlas and the skull. That's how important that dents is. And that atlantoaxial joint between the atlas and axis permits the shaking head no, right? This, it gets a little bit of, you can potentially get this, or if you want to argue rotation and nodding at the same time, that would be atlas and axis. That said, for dents, here is the dents location here on the axis here, from this posterior view from behind, posterior and superior. And then we have the superior articular facet, transverse foramen, transverse process, pedicle, lamina, spinous process or bifid process. Then atlas and axis, so here you have atlas on top of axis, and you have the axis of rotation, obviously going right through here, clearly. That's the spine itself, from joint to joint going down. The articular facets for the dens here, there's the dens there, and here's the transverse ligament, which becomes crucial, obviously, for limiting motion. The ligaments allow some and limit some, and of course the axis is providing the rotation mostly. And the vertebral prominence is C7. There's the transition there for the cervical thoracic vertebral region. The spinous process is longer than other cervical vertebrae, and it's easily palpated between the shoulder blades. And then I think we'll cover the thoracic vertebrae in our next video. We'll stop at this point here.